Welcome to the eClinicalWorks podcast. I'm your host, Brian Hughes. Today, we will be discussing how eClinicalWorks uses the power of technology to create a single location to accurately search, sort, and act upon patient health information from multiple healthcare entities. Here with me today to discuss eClinicalWorks One Patient, One Record is Hussein Elhaj with the Business Development and Enterprise Strategy team at eClinicalWorks. Hussein, thank you for joining us today.
My pleasure. Thanks for having me, Brian.
Now, Hussein, you've been with eClinicalWorks for quite some time now, and one discussion point over the years has been interoperability and the healthcare provider's ability to share patient records. Can you share with us some of the past healthcare industry frustrations of not being able to share medical records electronically and how it's evolved today?
Thank you, Brian. Yeah, I mean, I'll tell you that interoperability has essentially been the holy grail for providers. In the past, it's been perceived, especially in the early years, going back about 10 years, as elusive. And then the introduction of meaningful use, going back to 2010, really created a demand for the use of EMR technology. And that did eliminate much of the paperwork from a documentation perspective. However, from a data exchange perspective, there were still some difficulties. And then over the years, there was certainly progression with data exchange, and there were national alliances that came into play that allowed for a higher level exchange of data outside on a national level as opposed to just a regional level.
Interoperability has certainly come a long way, so much so new regulations have emerged over this time. Would you be able to speak to some of those items that help with regulation measures?
It certainly has come a long way, Brian. And if you look over the years, any organization out there, they have providers that are testing data. You may be familiar with meaningful use or MIPS, and that has progressed over the years. As a matter of fact, under MIPS, if you are attesting to MIPS, there's a whole category called promoting interoperability. So hopefully that tells you what the ultimate goal here is to promote interoperability and things focusing around information data blocking. So those entities like CMS, they want to make sure that there's transparency from a provider perspective, there's transparency from a patient perspective, and patients shouldn't be limited to how they receive their data. So these initiatives that are coming through the 21st Century Cures Act, through meaningful use and MIPS attestation, really play a central role over here. And we will certainly speak to some of those solutions that will help you as an organization meet the requirements.
Now, you previously mentioned nationwide networks, and two of those being Commonwealth and Carequality, which a lot of our listeners may or may not be aware of. But these two initiatives have paved the way for healthcare providers to be able to share patient records effectively, timely, and securely. Would you be able to tell us a little more about Commonwealth and Carequality and how eClinicalWorks work with these two initiatives to make sharing patient records a seamless process?
So, Brian, Commonwealth and Carequality really play an important role in data exchange currently, and they've contributed significantly to the progression of interoperability. As we talked about in the past, interoperability was kind of limited to the electronic healthcare exchange you were a member of on a community or on a regional level. With Commonwealth and Carequality, that exchange has really gone to a national level. So these two alliances have many of the big EMR names that you may be familiar with. All the big EMR players in the industry are a member of one or both of those networks. And eClinicalWorks thought it was extremely important that they are a member of both of these networks, so we can expand the opportunities for providers to exchange data. If these providers are using one or both of those networks, then the system will be able to query that data at the point of care. The moment the patient has arrived for their appointment, our system is smart enough to query that information. Any information that is found from external sources will be presented to the provider at the point of care. There are discrete data elements that providers will have the ability to import directly into the chart. Then in addition to that, as a provider, you will have the ability to delve in a little bit deeper to the actual encounter that took place and look at a discharge summary that was documented at the hospital, or it could have been a visit summary that was documented in an ambulatory care setting, really providing a more holistic view and allowing doctors the ability to look at that information and make the appropriate medical decision for the care that they're providing their patients.
There's it's a lot of different data points that
Yes.
are coming in, and being able to find that specific information that you're looking for. How has eClinicalWorks been able to take all of that data from all those different data points and made it actually useful and impactful for providers at the point of care?
That is an excellent point that you provide, Brian, because I'll tell you this, just from a data perspective, about 4 years ago, when we were first promoting the connections to Commonwealth and Carequality, we put out some data and we were, very proud of it. We were at the time exchanging about 8,000 medical records on a monthly basis. So those were numbers we were very proud of, and we were trying to promote it to get more people to sign up. Today, we are at a point where we are exchanging about 2.5 million records per day. So if you want to look at the trend, it is astronomical, I think, to say the least. Certainly a big trend. So what does that mean from a provider perspective? And the feedback is there's so much data coming in at the point of care that it can be overwhelming, as you stated, to providers, right? So if I'm looking at a patient's record, if I'm with a patient and they have an extremely complex case and maybe they have 10 or 12 different records from external sources at the point of care, I don't really have the time as a provider to, open up one encounter at a time and look for the data element that I need. So one thing that eCW has done, which is, I think, going to revolutionize this space, is the introduction of PRISMA. PRISMA is the industry's first search engine, medical record search engine. And what it's going to allow doctors to do at the point of care is, rather than sorting through individual encounters, they could search for the data element that they need, and PRISMA will take them to that specific encounter. For example, if a patient said maybe they had an ultrasound that was done at the hospital, and I don't know what record it is, I could simply type ultrasound and the system is going to take me to the record where the ultrasound was documented. Or if I'm looking for a particular medication to reconcile for the patient, maybe if I type in Tylenol, the system is actually smart enough to search for acetaminophen as well and show me a generic equivalent. Or if I'm typing an ECG, the system will know to search for an echo or an EKG. So it is smart in nature, making it easier for providers to gather the information they need within that 15 or 30-minute visit that they have with the patient. And this will contribute significantly when they're making that medical decision for the treatment plan for the patient.
And you gave some great examples, like mentioned before, but I think there's one in particular that I understand you've actually worked with an eClinicalWorks doctor by being able to find this information that had a profound impact on a patient's life.
This was definitely an eye-opening experience. And let me just preface this story by saying this is a new client that was actually in implementation, and our team and myself were providing assistance and go-live support. So essentially, this provider was a new user to eClinicalWorks. They were still learning how to navigate the progress note, just to kind of give you an idea. I was on standby as this provider started to see patients. And one particular instance, he comes out of an examination room with a sense of urgency that I hadn't seen before, and I knew this was important. I was standing next to his nurse, and he comes out and he tells his nurse very quickly, he's like, I need you to get the emergency room doctor on the phone for the hospital in the area. I need to speak to the emergency room doctor. And he said, there are 4 records that were in the system that we need printed for this patient. And he said, Hussein, could you please help her printing those records? Essentially, what had happened is he was looking at external records. The patient had a lipase lab result of over 12,000, and the patient was complaining from abdominal pain. Now, at the time, I didn't know what that meant from a medical perspective. I later learned, but we were able to access those records while he was speaking on the phone with the emergency room physicians, print them, get them all ready within a span of about 5 minutes, and we were able to send the patient to the emergency room, which essentially potentially saved this patient's life, because what I learned later was this was probably an indication of acute pancreatitis, and it could have been fatal if it wasn't addressed in that case.
That's an incredible story, Hussein, and one I'm sure all of our listeners will appreciate. Hussein, thank you for joining the podcast today. We really appreciate you having on.
It's my pleasure. Thank you so much for having me, Brian.
And thank you for watching our podcast today. You can catch more eClinicalWorks podcasts on iTunes, YouTube, and eClinicalWorks.com.